So sanitizing and taking all available precautions will become increasingly important as the country braces for a peak in COVID-19 cases. Wearing a face mask is particularly important to protect yourself as well as others against virus droplets. We find out now which materials offer effective protection with public health medicine specialist at UCT, Dr. Kerrin Begg. Thank you very much for joining us this afternoon. So oftentimes you'll see people wearing scarves, or they'll be wearing bandanas. Can we really say that that is you protecting yourself and others and constitutes wearing a mask?
Yeah, that's a very good question, and well done for addressing it. So earlier in April, when we were reviewing all of the evidence related to masks, and particularly cloth masks, the evidence really seemed to indicate that we need to look at multiple layers of thick weave masks, so thick weave materials. So t-shirt material is then not appropriate. So I just wanted to, I brought some examples for you. So the idea is that a mask is not just about the material that you use, but it's also about the number of layers. So in this kind of a mask, there's 3 layers. It's a homemade mask, but it has 3 layers. And as you can see, it has a very densely weaved material on the outside as well as on the inside. And the important thing is that you shouldn't do what I've just been doing and demonstrating to you, is touch the mask in any way. So I'll talk about wearing of masks in a moment. Whereas when you look at something like a bandana, you can see that, first of all, it's stretchy. And in fact, I think that you can see some of the reflection behind me right through the mask. And that clearly indicates that droplets are not going to be contained behind this mask. So if we remember that our mask is actually to stop us from coughing through or sneezing through the mask, my mask protects you and your mask protects me. And so what we're really wanting to do is to keep our own droplets behind our masks. And so really looking at any kind of mask that covers that has multiple layers, that is made of thickish material, and that covers from above the nose to below the chin. So it really needs to be big enough, and then preferably masks that have some sort of ability to expand because of our nose and our chin, so that it can go over. And of course, any kind of how it attaches to your head is appropriate. So the important thing when wearing a mask, this is also appropriate if it doesn't have a folds in it, but actually has some sort of shaping to accommodate for your nose and chin. The important thing about a mask is that one shouldn't be touching anywhere on the mask, particularly not on the inside, which is where your respiratory secretions attach to it. So when you don, which is putting on, and doff your mask, which is taking off, you really need to only be touching the things that are attaching either to your ears or around your head. So I'm going to demonstrate. And then you can fit it and then take it off. But you must not touch the inside of the mask. So the idea then is to take your mask and deposit it directly into a container that for washing, so that you don't spread the virus further. So what you're really trying to do is assume that you are positive and try to prevent anybody else from getting infected from your assumed positivity. And so that's why things like bandanas are particularly difficult, because as you can see right through it. It's stretchy, so whatever the secretions that are coming from you are going to go right through. So they're not particularly protecting anybody else who is then passing you. So unfortunately, whilst bandanas are much easier to wear, much more comfortable to wear, they actually are not very helpful for protecting against the spread of the disease.
What about a scarf? You oftentimes see people wrapping it multiple times around their faces.
So that's also tricky. So remember that I'm also wearing a scarf here, is that, it also depends on the type of material or the type of scarf. So this too actually is even at a double layer, you can actually see the reflection of the window behind me through it. And so that's also partly problematic. You can actually see the weave is not particularly tight. So if I were to cover across my nose and mouth, you can still spread droplets through it. So obviously the more layers makes it a little bit thicker, but as you can still see light through it. So it really needs to be something, a tight weave, something similar to this, that you can't actually see through, that has multiple layers, and something that you really cannot sneeze or cough through is preferable. Clearly, this is all relative. So if you have nothing else, then a T-shirt, a bandana, a scarf is certainly going to be better than nothing at all. But if you are going to be wearing a mask on a regular basis and intend to be protecting other people by wearing it, then it needs to be something with a tighter weave.
How to store your mask when you doff it? So for people who, let's use us for an example, where you have to take your mask off for a particular period and then you take it, you don it back on when you leave work. How do you store it?
So preferably you can use something like a Ziploc bag that you can do it so that nobody else is touching anything related to you. The very important part is around making sure that you don't touch the inside. So something like this is very useful because you can close the inside of the mask and you're now not touching the parts that are on the inside. And then you can drop it into your Ziploc bag. And then later, when you need to use it, you can pull it out again by its straps, which means that once again, you're not touching it. Preferably, you should then be wearing a new mask again every day. If you have any symptoms, then of course, stay home. And your mask should then only be worn to assist people to protect the family members and household members inside your home from getting the disease. So it's really important to have multiple masks, preferably at least 2 to 3, so that one is in the wash, one is being worn, and you have one spare in case it gets wet. So the important thing is that if your mask gets moist, it's effectively got your respiratory secretions on it, whether through heavy breathing or whether saliva through or any of your other secretions, your mucus secretions from sneezing or coughing. Whatever way, it's now no longer safe to wear when it's moist or wet. And at that point, you need to alter it. That's also, or change it. And that's also a very important time to store it in a Ziploc bag, wear the fresh mask, and then take the dirty mask home and clean it. Obviously, your Ziploc bag then also needs to be disposed of if it's been storing a wet mask.
Curious, Dr. Begg, to find out what you've made of developments in the United States, where we've seen some senior government officials not wearing their masks, people going to rallies and not wearing their masks and saying that, well, we're simply not going to be wearing masks.
So the challenge is that this is not a linear or a categorical process where an absolute, where you do wear a mask, it protects you. You don't wear a mask, it doesn't protect you. It's all about relative protection. And what we know is that masks alone don't protect us entirely from getting the disease. But certainly wearing masks provides, on a population level, a greater level of protection than not wearing masks at all. Similarly, hand washing provides a fairly high degree of protection, but is not entirely protective. And physical distancing similarly. So when we use them all together, we then start to get a cumulative protection level, and so our relative risk of contracting the disease therefore drops. Unfortunately, too, just simply standing next to somebody, even if you don't take or any of those measures, not everybody will be infected. So we know that with the reproductive rate and the infectious risk of COVID, that somewhere between 3 and 4 people out of 10 exposed to an infected contact will become infected. But that is all dependent on distance, duration, and dose. So somebody sneezing heavily who has a high viral load is early in their disease process. Sneezing towards somebody who's very close to them. So there's a high dose because of the sneeze and the high viral load in the sneeze. Standing very close, so the distance is very short. And the dispersion factor is that you're standing very close, and so the dispersion is immediate, and the person standing close by is not wearing a mask. That person has a much higher risk than somebody who is not. But nevertheless, that person may not be infected at all. And so it's very difficult for people to appreciate that this is really about a broader community-based response. and that the more people wearing masks, physically distancing, and doing what they need to do will be protective for the vast majority of people. Whereas the difficulty is that some people who don't adhere to any of these measures may still be lucky and not be infected, even if they're standing next to somebody who is infectious. And that's really the difficulty, is trying to convince people to do the right thing, even if it doesn't protect you, and even if it does protect somebody else that happens not to be that you don't know and that is foreign. And so it really requires a significant degree of social solidarity, of my behavior protects multiple other people around me, and your behavior potentially affects me. And so it's difficult when it's a relative aspect and not an absolutist aspect, for people to then continue to adhere to these things.
Thank you very much for your time this afternoon, Dr. Kerrin Begg, Public Health Medicine Specialist at UCT.